You hear the term heart failure all the time, right? It's one of the most common reasons people end up in the hospital, but it can be really misunderstood. Today, we're going to demystify left heart failure, and we'll do it by thinking about it in the simplest way possible, as a problem with the body's most important pump. So let's dive in. All right, so here's our game plan. We'll start by defining what the problem even is. Then, we'll look at why the pump fails in the first place, check out the body's warning signs, see how doctors actually investigate it, and wrap up with how this condition is managed. Okay, first step, the pumping problem. Let's get right to the heart of what left heart failure actually means. So the official definition looks kind of scary, right? But honestly, it boils down to two main issues. First, you see pulmonary congestion. Just think of that as a plumbing backup. Fluid gets stuck in the lungs, which you can imagine makes it super hard to breathe. And second, reduced systemic perfusion just means the pump isn't strong enough to push all that good oxygen-rich blood out to the rest of your body. So let's just boil it all down. At its core, the heart's main pumping chamber, the left ventricle, is just struggling. This simple idea, this pump problem, is what you need to keep in your head as we go through everything else. But, a pump doesn't just fail for no reason. So the next logical question is, what could possibly damage or overwhelm the body's main engine like this? Well, it turns out there are a few usual suspects. A heart attack can damage the pump's muscle directly. Chronic high blood pressure can force the pump to work way too hard against constant resistance. Leaky valves can overload it, making it deal with too much fluid. And sometimes the heart muscle itself is just diseased, or an irregular heartbeat throws the whole system completely out of whack. Now, this is where it gets really interesting. The pump can fail in two completely different ways. On one side, you've got systolic failure. Think of this as a squeezing problem. The pump is just too weak to push the blood out effectively. But on the other side, you have diastolic failure. That's a filling problem. The muscle is so stiff and rigid that it can't relax enough to let a normal amount of blood in. Two totally different mechanical issues, but both end up causing the same big problems. So if the body's main pump is failing, you better believe it's going to send out some serious warning signs. Let's take a look at what those are. This really shows the chain reaction perfectly. It all starts with that weak pump. That means less blood is going forward where it needs to go. This creates a backup. Pressure builds backward, kind of like a traffic jam on the highway, and it backs up all the way into the lungs. And then fluid starts to flood the lungs. And all that fluid in the lungs? Well, that's what causes these classic symptoms. You get out of breath just walking up some stairs. You might find you need 3 or 4 pillows just to be able to breathe when you lie down at night. Some people even wake up suddenly in the middle of the night, gasping for air. That nagging cough, that constant feeling of being tired, it all points back to that fluid backup. And this combo right here is a massive clue for doctors. You see those two terms, orthopnea and PND? Orthopnea is that trouble breathing when lying flat, and PND is waking up breathless. If a patient has both of those, well, that's one of the biggest red flags you can get for left heart failure. Okay, so the warning lights are flashing. How do doctors confirm what's going on? You can think of it like a mechanic trying to figure out what's wrong with a car engine. They need to run some diagnostics. I mean, they can't just pop the hood and take a look, right? So what tools do they actually have to get a clear picture of what's going on with the pump? Well, the investigation starts with a few key tests. They'll do blood work to check for a hormone called BNP, which the heart pumps out when it's under stress. They'll run an ECG to check the heart's electrical system for any damage. And a chest X-ray can literally show them if the heart looks enlarged or if there's visible fluid in the lungs. But all of those, they're just clues. The real gold standard, the single most important test they can run, is the echocardiogram. It's basically an ultrasound of the heart. It lets doctors see the pump working in real time, measure its squeezing power, and absolutely definitively confirm the diagnosis. It's a game changer. So, once the pump problem is confirmed, what's next? This brings us to the toolbox for actually managing a failing heart long-term. When we're talking about long-term treatment, there are really two big goals here. The first and most obvious one is to relieve all those awful symptoms we just talked about. But the second, and you could argue more important goal, is to actually improve a person's long-term survival. And this is where the type of medication becomes absolutely crucial. You have diuretics, also known as water pills. Their main job is symptom relief. They help get rid of all that extra fluid. But then you have other drugs like ACE inhibitors and beta blockers. You can think of these as protecting the pump itself from more damage. They're the ones that are proven to improve long-term survival. So, if you take away one thing from this whole section, let it be this distinction. It's so important. Diuretics make you feel better day to day, but ACE inhibitors and beta blockers are the drugs that help you live longer. They aren't for immediate symptom relief, they're playing the long game. Understanding that difference is absolutely vital. So that's the chronic, day-to-day management. But what happens when things go really wrong? When it's not just a slow decline, but a sudden, life-threatening emergency where the lungs fill with fluid? In an emergency room, there's a really handy mnemonic that doctors use to remember the protocol: LMNOP. L is for powerful loop diuretics to get that fluid out fast. M is for morphine, which helps reduce anxiety and take some strain off the heart. N is for nitrates to open up blood vessels. O is for oxygen, of course. And P is for position. Sitting the patient upright makes it so much easier to breathe. It's a rapid-fire, life-saving checklist. And that brings us to our final and maybe biggest question. When you really understand that some treatments are about feeling better right now, while others are about having a better tomorrow, how does that change the way we look at managing any long-term illness? It's this constant balancing act between the quality of our days and the quantity of them. It really makes you think, doesn't it?